Welcome back to our channel. Today, we're diving into the fascinating world of antihistamine drugs. You may know them as the medications that help relieve allergies and hay fever symptoms, but there's so much more to these drugs than meets the eye. Get ready to be amazed by some mind-blowing facts about antihistamines that you probably didn't know. Let's jump right in. History of antihistamines. First off, let's talk about the history of antihistamines. Did you know that the first antihistamine drug was discovered by accident in the 1930s? A research team was actually looking for a cure for motion sickness when they stumbled upon the antihistamine properties of a compound called diphenhydramine. This accidental discovery revolutionized the treatment of allergic reactions and paved the way for the development of many other antihistamine drugs we use today. Types of antihistamines. There are two main types of antihistamines: first generation and second generation. First generation antihistamines, like diphenhydramine and chlorpheniramine, have been around longer and tend to cause more sedation and drowsiness. On the other hand, second generation antihistamines, such as loratadine and cetirizine, are newer and are less likely to cause drowsiness, making them a popular choice for daytime allergy relief. It's important to know the differences between these two types of antihistamines so you can choose the one that best fits your needs. How antihistamines work. Have you ever wondered how antihistamines actually work in the body? When you come into contact with an allergen, your body releases a chemical called histamine, which causes the symptoms of an allergic reaction, such as itching, sneezing, and a runny nose. Antihistamines work by blocking the action of histamine, which helps to alleviate these symptoms. They do this by binding to histamine receptors in the body, preventing histamine from attaching to them and triggering an allergic response. It's like putting a stop sign in front of histamine, telling it to stay away and leave you in peace. Common side effects. While antihistamines are generally safe and effective for most people, like any medication, they can have side effects. Some common side effects of antihistamines include drowsiness, dry mouth, blurred vision, and constipation. These side effects are more common with first-generation antihistamines, which have a stronger sedative effect. Second-generation antihistamines are generally considered safer and cause fewer side effects, but they can still cause drowsiness in some people. It's important to talk to your doctor or pharmacist if you experience any side effects while taking antihistamines. Antihistamines and drowsiness. One of the most well-known side effects of antihistamines is drowsiness. This is because antihistamines can cross the blood-brain barrier and affect the central nervous system, causing a sedative effect. However, not all antihistamines cause drowsiness to the same extent. First-generation antihistamines are more likely to cause drowsiness, while second-generation antihistamines are designed to be less sedating. If you find that antihistamines make you too drowsy, consider switching to a second-generation antihistamine or taking them at night when drowsiness won't interfere with your daily activities. Antihistamines in pregnancy. If you're pregnant or planning to become pregnant, you may be wondering if it's safe to take antihistamines. While antihistamines are generally considered safe for use during pregnancy, it's always best to consult with your healthcare provider before taking any medication. Some studies have suggested a possible link between antihistamine use during pregnancy and certain birth defects, so it's important to weigh the benefits and risks of taking antihistamines while pregnant. Your doctor can help you make an informed decision about whether antihistamines are the right choice for you during pregnancy. Antihistamines in children. Antihistamines are commonly used to treat allergies and allergic reactions in children, but it's important to use caution when giving these medications to kids. Some antihistamines are not recommended for children under a certain age, so make sure to check with your child's pediatrician before giving them any antihistamine medication. Additionally, antihistamines can cause side effects like drowsiness and irritability in children, so it's important to use them only as directed and under the supervision of a healthcare provider. Addiction potential. One interesting fact about antihistamines is that some people may develop a dependence on them, especially those that cause drowsiness. This is because antihistamines can have a calming and sedative effect, making them appealing to some individuals who may misuse them for their psychoactive properties. While antihistamine addiction is rare, it's important to use these medications only as directed and to seek help if you find yourself becoming dependent on them. Remember, antihistamines are powerful medications that should be used responsibly and under the guidance of a healthcare provider. Antihistamines and overdose. Another important thing to be aware of when it comes to antihistamines is the risk of overdose. Taking too much of these medications can lead to serious health complications, including dizziness, confusion, hallucinations, and even seizures. In severe cases, antihistamine overdose can be life-threatening, so it's crucial to take these medications only as directed and to seek medical help immediately if you suspect an overdose. Keep your antihistamine medications out of reach of children and follow the dosing instructions carefully to avoid any potential harm. Conclusion, and there you have it, folks. We hope you've enjoyed learning some fun facts about antihistamine drugs that you may not have known before. From the history of antihistamines to their mechanisms of action and potential side effects, there's so much more to these medications than meets the eye. Remember to always use antihistamines responsibly and to consult with your healthcare provider if you have any questions or concerns. Thanks for watching, and be sure to hit that like button and subscribe for more fascinating content. See you next time.